And the radiotherapy has caused quite a lot of problems, really, because it stopped the tongue working properly. It's made my face like a piece of wood. It's just solid. And yeah, it's affected my throat a bit.
It also caused some necrosis of the jaw, didn't it?
Yes.
Which broke down, and you ended up having to have further procedures and also wear protective cords there for a while.
Yes, the necrosis of the jaw, then the body was rejecting the dead bone, so it was trying to get out through a hole in my face. It was making a hole there to come out of, and I did have a week back at the hospital because they were trying to stop it coming out. It was better when the body was left to sort itself out. So, you know, odd days I think, oh, it feels a bit rough there, and I'd get the tweezers and pull out another bit of bone. Oh, what do I do with that then? I throw it away. So, bits of my bone all over the place. Mind you, it was dead bone, it was no use. And then a few days later, oh, another bit of, pull the bone out, throw it away. Well, there's a lot of this happening. But anyway, then eventually it stopped, so I didn't have to have my face bandaged up all the time. But it's made a few holes here, so that's another little thing. And then the blood vessels burst, and that's... I was offered oxygen therapy, which is used on divers that get the bends. And I went down to see the setup and the thing you went in, and the two gentlemen there were really good at explaining every little detail about the oxygen therapy and how it worked and so on and so forth. And that can enliven the bone so that it can bring it back to life. If not completely, it can do it partially. But sadly, the PCT refused it, which is a shame because it was going to work out quite a cheap therapy if they made full advantage of the fact that you could have 12 people having therapy at the same time. I personally knew of 3 others that would have gone, and I'm sure there were more in big, you know, could have scraped the county, got 10 people, 12 people. So it would have been quite a cheap thing. I think it was £120 a treatment or something, so it would have worked out at 10 per person, wouldn't it? Would have even paid it ourselves, really, I suppose. Anyway, PCT refused it, so that was that. That, I think, was a shame, because I'd like to have kept the jaw, because that then has affected teeth, and so I have quite a lot of difficulty with teeth. And at one time I was developing fangs on my front teeth. And so I can't go around like this, like some monster. And he's been ever so good, he's been patient all the way through, and he built me some teeth, you know, just filled in a little bit that was missing, hence got rid of the fangs.
So you've had a struggle, really, getting back to normal after initially the surgery, then the chemotherapy and radiotherapy. And that radiotherapy has caused those long-term delayed side effects, which only recently have started to resolve, I guess.
What it is down to now is me accepting it and building my life to encompass those things, so that they're not a piece that I'm getting angry with, but they're a bit of me that are part of me, and I've got to build around it. When I go to restaurants, people are really good there, and they will give me the extra serviettes, and I'll have a spoon instead of the knife and fork, because there's no point in those. And so I'm having to encompass it and include it in my plans. So there's a lot more planning before I do things or before I go to places. There's also a lot of medication because I have a tremendous amount of pain in my mouth, a lot of soreness, ulcers, and so the painkillers do a lot. But then I have a spray as well, which that helps a tremendous amount. But there is always pain there, sadly, of one sort or another.